There are roughly 7 billion people living in the world today. Heart disease is the #1 global cause of death, taking roughly 17.3 million lives each year. Stroke is the #2 cause of death, taking over 6 million lives. With a few minor lifestyle changes, we can radically reduce the number of people affected by these deadly diseases. I'm joined by Dr. Mark Chandra and Dr. Jyoti Kadekar, who are here to give us some practical advice about stroke and heart disease. Thank you guys so much for joining me.
Oh, no problem.
So you guys are married and you have a practice in Lindsay? Is that
That's
correct?
right.
Yeah,
Lindsay,
that's right.
Ontario.
Great. Well, I'm so happy to have you here because I have a very limited understanding of stroke and heart disease. So I'm glad you guys can educate me.
We'll do our best.
Well, just like John said, stroke and heart disease are a major health concern in Canada right now and represent a tremendous burden on our healthcare system. Like he was saying, I think the statistic says that every 7 minutes right now in Canada, somebody suffers a heart attack, and every 10 minutes, somebody suffers a stroke. So we're talking about some serious issues. They're the second and third leading causes of death in this country right now, the first one being cancer.
Wow. That's unbelievable. Well, tell me a little bit, what is heart disease, Jyoti?
So cardiovascular disease is disease that involves either the heart, the blood vessels leading to the heart, or the blood vessels that supply the rest of the body, so including the brain. So it's disease that involves any of those things.
Absolutely. And heart disease and stroke come under cardiovascular disease, correct?
That's correct.
Okay, so what leads to heart disease?
So we're looking at risk factors for heart disease, and those include high blood pressure, high cholesterol, diabetes, and then we're also talking about family history. Finally, lifestyle choices.
Sure. What are some symptoms? How can we identify whether we're at risk for heart disease?
Well, there are a lot of symptoms of heart disease, but unfortunately, the symptoms don't actually come until the disease is fairly advanced. Like, for example, I could be developing diseases in my coronary arteries right now, and I wouldn't even know it. I guess in a lot of ways, that's what we're talking about when we say heart disease. The heart's an amazing organ, and indeed, we are fearfully and wonderfully made by God. It's an organ that, I guess it's a muscle that starts working before we are born and works non-stop for our entire lives. But the amazing thing is that God made it so that the more that the organ works, the stronger it actually gets. But you can imagine this organ, whose job it is to supply blood, also needs a blood supply of its own. And its blood supply comes from these special blood vessels called the coronary arteries. They're called coronary because they circle around the heart and it looks like a crown. So just like coronation, you get the word coronary artery.
Sure.
And what can happen is these coronary arteries over time, especially if you have those risk factors, start to develop these fatty plaques inside. And what happens is the blood isn't able to go through as easily and parts of the heart start getting starved for blood. And when that happens, then you start getting the symptoms.
You do a great job. You're a doctor, you can tell, because you do a great job of speaking to the average person, because my level of knowledge is not very high.
So you can imagine, like, when muscles in your body don't have enough blood, they start to hurt. And it's the same thing with your heart. So imagine you're outside shoveling snow, or you're going for a brisk walk or something, and you've never known you've had heart disease. All of a sudden, your heart's beating faster, it's working more, and start saying, wait a second, I'm not getting all the blood that I want. And the next thing you know, you start feeling short of breath, you start having some chest pain, you start feeling tired, maybe even you start feeling a bit nauseated. And that can be the first symptoms of heart disease. But like I was saying, unfortunately, by the time that happens, your heart disease is fairly advanced.
Right. So what do you do once you notice these symptoms? I mean, what's the next step?
Certainly you want to check in with your primary care physician and have yourself checked over for risk factors based on whether you've got risk factors. Your family physician may then decide to go on to investigate further, and that could involve blood work. It may also include an EKG, which is where they do a tracing of the heart. It may also include something like a stress test, where you get up onto a treadmill and you start stressing the the heart. And
So talk to me about stroke. How do you differentiate the two, heart disease and stroke?
A heart disease can eventually lead to something called a heart attack. So what can happen is those plaques in your heart, like in the coronary arteries, can rupture, and the body starts forming a clot around those ruptures as a way to protect itself. And this clot actually can suddenly deprive the heart muscle of blood, and that causes the heart muscle to die, and that's called a heart attack. And it's useful to think of that when you're thinking of stroke as well, because a very similar thing is happening in the brain. You can almost think of a stroke as a brain attack. So a part of your brain is not getting the amount of blood that it needs, and that part dies as well. And we often talk about the two together because the risk factors for heart and stroke are very, very similar. And in terms of the way that we approach them, certainly if you were ever to get any of the symptoms that we talked about, it may be good to go to the emergency department right away, because there are things that can be done, but time is of the essence.
Right, time is of the essence. And if you don't catch it early enough, what are the long-term effects?
The long-term effects can be profound. I'll be honest with you, one of the significant issues that can happen with coronary artery disease or stroke is sudden death, right? Cardiac arrest. And if that happens and you can get to help fast enough, not only can you save your life, but you can minimize the impact of the diseases. For example, if you are having a stroke, there are certain things that you can do in the hospital setting to actually start to reopen the blood vessels and start to perfuse those damaged parts of the brain again. But again, time is of the essence. There is an acronym that the Heart and Stroke Foundation is using right now for stroke. It's called FAST, F-A-S-T.
Explain to me what FAST is.
so it's a nice, easy way to remember what symptoms you want to be looking out for. F stands for face. So if there's any asymmetry in the face, if part of the face looks like it's drooping, that's one sign that you want to be looking for. A stands for arms. So if there's any weakness in the arms, that's another concerning feature. S stands for speech. So if there's any slurring of the speech, again, another concerning symptom. T stands for time. So if you've got any of those things present, it's time to call 911.
Absolutely, and it's better to be safe than sorry.
Absolutely.
Absolutely. And you want to actually, it's important for viewers to understand that you want to pick up the phone and call 911. You don't want to be driving yourself into the hospital because as soon as you contact 911, it starts a whole process that you can't activate yourself by driving into the hospital.
Like there are many hospitals that do not offer the acute stroke protocol that can save your life. And you may, in best intentions, go to your nearest hospital, but if they don't offer that service, they'll be sending you to a different one. Whereas when EMS arrives, they know the centers that offer that in your area. Call ahead and let them know that somebody is coming in that could be having a stroke or heart attack, and then the team there can get ready to process you and save as many heart cells and brain cells as they possibly can. As they used to tell us in medical school, time is muscle. And I guess the same thing as the brain, time is neurons.
Yes, definitely. Well, thank you guys so much for educating me about this and educating our viewers. I mean, I just can't stress this enough. If you have any of these symptoms, please go and be seen by a physician as soon as possible because, like the doctor said, time is of the essence.